welcome to RAAONLINE. Today's topic is perioperative management of subarachnoid hemorrhage. So, as you all be knowing, the most common cause of subarachnoid hemorrhage is trauma. Usually, traumatic subarachnoid hemorrhage happens in the sulcal spaces as seen in this CT scan, axial plane CT, which is showing some hyperdensities in the sulcal spaces. These are usually the convexity sulcal spaces, that is on the top, and trauma usually causes SAH in this region. Whereas an aneurysm which is causing 85% of the subarachnoid hemorrhages that happen because of non-traumatic causes. So, the non-traumatic cause for subarachnoid hemorrhage most commonly is aneurysms. So, the aneurysmal subarachnoid hemorrhages usually happen in the basal cisterns. Here you are seeing blood in the thick blood, actually in the suprasellar cistern. We can see it extending in a star shape to both sylvian cisterns, and also it is going along the interpeduncular cistern and the crural cisterns, and also extending behind into the quadrigeminal cistern and ambient cisterns. So, this is how the bleed in aneurysmal subarachnoid hemorrhages. So, you would not investigate for an aneurysm when you see such a scan with SAH in the convexity sulcal spaces, but even if you see a little bit of blood in the subarachnoid spaces in the base, then you would suspect of an aneurysm. Sometimes the patient might be brought with a history of trauma, a simple fall at home, and there will be blood in the basal cistern. At that point in time, we should not think that the subarachnoid hemorrhage is caused by trauma. It is basically probably because of a small aneurysm which has bled, and probably a sentinel bleed which has not caused much of affection to the patient. Always suspect an aneurysm when there is a basal bleed. So, as I mentioned, 85% of subarachnoid hemorrhage is in non-traumatic cases is because of aneurysms, but 15% of them can be because of other causes. In 5% of them, we really do not know what the cause of subarachnoid hemorrhage is caused by, but in 10% of cases, it can be because of this pretruncal SAH. By pretruncal, we mean the prepontine and the perimesencephalic cisterns. So, you can see in this T1 plane sagittal sections, there is some blood in the perimesencephalic cistern here, and then here you can see blood in the prepontine cistern. Sometimes there may be blood in the perimesencephalic and the prepontine cisterns. So, 10% of hemorrhages can be because of pretruncal SAH, which is usually benign. Benign as in they are not caused by aneurysms, and they may recur, but when you do an angiogram in these patients, there are no aneurysms. So, our general protocol is to do an angio in these patients, prove that there are no aneurysms, and you call them angionegative SAH. So, when you call them angionegative SAH, you would like to review them after 6 weeks, ask them to come back after 6 weeks, repeat an angio here again, repeat angio, and then again once the angio is twice negative angio, you call them definitely angionegative SAH. So, you will need to do angiogram twice in these patients 6 weeks apart and confirm that there is no aneurysm. The cause for these pretruncal SAH is relatively unknown, but there are some veins which could have bled and caused this subarachnoid hemorrhage. Generally, veins are not present in the subarachnoid space. So, it is some arachnoid rent which had allowed the blood to go inside, but nobody is sure why these pretruncal SAH happens.